I'm sorry, I don't know why I did
Oh,
that.
there you go.
Okay.
Hello, my name's Katie. I'm going to be the student nurse anesthetist. I'm an RN getting my degree in anesthesia, and I'm going to be doing your anesthetic plan if that's okay with you.
Yes, that is okay.
Awesome. So before we begin, I'm just going to sit down next to you. Can I confirm your name and date of birth?
Yes, my name is Bo Allen, date of birth February 23rd, 1998.
Okay, so I'm just going to go over and confirm a couple things. I know you've probably already said this all before, but I just want to make sure we got everything right. So first of all, any medical history, anything you've been diagnosed with?
I have asthma. I have sports-induced asthma.
Okay, and do you use an inhaler, take any medication for that?
Yes, I use an inhaler.
When's the last time you did?
Yesterday.
Okay, and have you had any wheezing, coughing, anything like that since then?
Nope.
Okay, and you just took it for exercise?
Mm-hmm.
Okay, and any hospitalizations ever for asthma?
No.
Okay, and while we're on exercise, what do you do for exercise?
I bike, I run, yoga, and Pilates.
Okay, awesome. So definitely can walk up a flight of stairs without shortness of breath.
Yes.
Awesome. And then, have you ever lived outside the U.S.?
No.
Okay, and then have you ever gotten tested for TB or anything? Has that ever come back positive? Ever lived around anyone with TB?
No. Nope.
Okay. And then, have you been vaccinated for the flu?
Yes.
Okay. And then any recent illnesses, any recent upper respiratory infections?
Nope.
Okay. And you have any history of sinus infection?
No.
Okay. And I'm gonna just real quick screen. Have you ever been diagnosed with sleep apnea?
No.
Okay. We're gonna do a really quick screening for it just to make sure everything goes well during surgery. Do you snore?
I do not snore.
Okay. And has anyone ever told you that they've seen you not stop breathing while you're sleeping?
No.
Okay. And have you ever been diagnosed with high blood pressure? Has the doctor ever told you your blood pressure's high?
Nope.
And so the patient's BMI is not greater than 35. They are not greater than 50 years old. They do not have a neck circumference of greater than 16 inches, and they are not male gender, so they have a very low risk of sleep apnea. Moving on to the rest of our questions. Any allergies?
No.
Okay. And has anyone in your family had any issues with anesthesia?
Nope.
Okay, so now we're just going to do a quick exam of your lungs and chest. So normally when doing this, I'd have the patient put on a gown and make sure that their chest is bare. But for the purposes of privacy for this video, we're just going to keep our patient like this. So first I'm going to observe your chest. The patient is breathing normally, speaking in full sentences, not concerned of any respiratory distress. We're just going to look at your fingers and have you make like almost a little heart. Put these two pointer fingers together and just like that. Keep the little knuckles, so we can see a little window beneath his fingers, so no clubbing. Put that down, and then can you put your lip out? So I can just check, and it's nice and pink, you're good. And then if you pull your eyes down, and we're not pale there, nice and red, definitely not concerned for any cyanosis. I'm now gonna palpate the front of your chest. Is it okay if I touch you?
Mm-hmm.
I'm just gonna palpate over here. Do you have any history of like any surgeries, anything like that?
Nope.
Any pain, bruising?
Nope.
Okay, and I don't see any lacerations. There's no like surgical scarring. I don't see a pacemaker implant right there. So for this next part, we're just going to have you take a big deep breath in and out. And one more time, in and out. And out. Okay, so my fingers expanded by greater than 3 centimeters, so we are good for chest excursion. I'm now going to have you lie down for this part. Okay, so now I'm just going to listen to your lung sounds.
Okay.
I'm going to start right above the clavicle, and again, I would be doing this on a bare chest normally. Take a big deep breath in and then out. And breathe in and out. And then in and out. And I'm just going to displace their breast a little bit so I can make sure to get to the side of it. And in and out. And again, in and out. Awesome. I heard no adventitious lung sounds. It was all vesicular lung sounds, except right here around the clavicles, and then those were bronchovesicular. So you can sit up for me, please. Thank you. And now I'm going to examine the back of your chest, thorax. So first we're going to start again by assessing, making sure that our spine is nice and aligned. There's no kyphosis, no lordosis. And we also checked the front, make sure that the pectorals were nice and there was no pectus extravagum. We'll cut that out. So next I am going to check for chest excursion on this side. So putting my thumbs around the 10th rib and then having the patient breathe, and then have the patient breathe in and out. Good. And again, we got around 5 centimeters on that side, which is good. Next, I'm going to percuss. So we're gonna start up here, and I'm gonna have the patient put their arms around and almost give yourself a hug. There you go. And then you can kind of roll your shoulders forward a little bit. And then we're gonna start all the way at the top, and then this will pull a scapula away. So now I'm going to just percuss. And we got resonant lung sounds all throughout, especially because my patient had asthma. I was making sure that none of the sounds were hyperresonant, which would indicate air trapping. Next, I'm going to listen. I'm going to start at the C7 spine, which is the first large bony prominence on the neck. It's like right here. And again, I would be doing all of this without close. Big breath in and out. In and out. And again, we had all vesicular lung sounds on this side, and make sure not to auscultate over the scapula. And then we're lastly gonna do bronchophony. So I'm gonna listen, and I'm gonna have you, please, I'm just gonna make sure that there's no, any sort of like fluid or any buildup in your lungs. So I'm just gonna have you say 99 every time I put the stethoscope on your back.
Okay. 99. 99, 99, 99, 99, 99, 99, 99.
And all the sounds were muffled as we went down, so we're not concerned for pneumonia or anything. And that is about it. We will be back soon to do your anesthesia, okay? Do you have any questions?
Nope.
Awesome. Thank you so much.